Thank you, Madam Chairman. Mr. Attorney General, thank you very much for being here. As I'm sure you're aware, what we've seen in New Hampshire and northern New England is a real epidemic spread of heroin and prescription drug opiate use. And we're seeing that very much in New Hampshire over the last 10 years. The number of people admitted to state treatment programs has increased 90% for heroin use and 500% for prescription drug use. And just in the last year, we've seen double the number of deaths from heroin abuse between 2012 and 2013. Now, this summer, New Hampshire plans to institute a new prescription drug monitoring program in the state because of a Department of Justice grant that we have received. And I wonder if you could comment on how effective these types of monitoring programs have been in other parts of the country and what other federal resources might be available to help us in the states as we try and combat this real epidemic of heroin and prescription drug use.
Well, Senator, I think you're correct to point it out, and the term that you use, I think, is a correct one. There is an epidemic. It is one that we certainly see in your state, in that region of the country, but it's something that we see nationwide. And I think we have to have a balanced approach to dealing with this. There has to be an enforcement component to this. The DEA will lead that. We have an increase of more than 320% between 2008 and 2013 about the amount of heroin that we have taken from the cartels that was meant for our shores. But beyond that, enforcement alone is not enough. We have to come up with we have to also make sure that we identify this problem as a public health problem. Police officers, doctors, educators, we have to come up with treatment programs, prevention programs, educational programs. I don't think that we should repeat the mistake, frankly, that we made when we dealt with the crack epidemic, where we looked at it only as an enforcement issue. There has to be an enforcement component, but we have to bring into play all of these other resources that we have, including supporting the programs that you have described, these monitoring programs. It is why I think it is so important that our capacity to aid our state and local partners be made whole in our budget. We want, these are issues that the federal government clearly has an interest in, but on the ground, it's our state and local partners who have to do these kinds of things, and I want to have the ability, through our grant-making ability, to support these efforts.
Well, thank you, and obviously the burn justice grants have been very helpful to us in New Hampshire, and there has been a real coordinated effort on the part of law enforcement. I would hope that you might consider sending someone up from the Justice Department to meet with our local law enforcement officials as we try and address this issue, because as you point out, it's going to require a multi-level approach to really do something to make a difference as we look at how many people are being affected. Can you talk a little bit about some of the other efforts the department has undertaken to better integrate these kinds of strategies, other than, we know the burn grants are very helpful. We know that the monitoring programs are another way to try and address it. What else is the department doing that can be helpful to states like New Hampshire?
Well, we certainly have a variety of things. I mean, we have a great U.S. attorney in New Hampshire, and so there is—
Who's doing a great job, I might add.
And so there is certainly the help that we can give on the enforcement side there. With regard to grants, I think that's certainly something that we want to consider. We have the COPS program so that we have an ability to put more police officers on the ground, again, to deal with these kinds of issues. We also want to come up, I think, with programs that we work with the Department of Health and Human Services, as the chair had suggested. This has to be something that is more than simply a Justice Department initiative. And I think that we have the ability now to really potentially nip this in the bud. But I think the time for us to do this is we have a relatively small window before this potentially gets even more out of control than it is. And I think, as I said, if we take a balanced approach involving agencies beyond the Justice Department, making sure that we are supportive of our state and local partners, And so that we, and also that we educate, and especially educate young people about the dangers of prescription drug use, opioid use, and the problem with heroin use. I think that we can really have a significant impact on this problem.
Thank you. Thank you, Madam Chair.